Hi, my name is Rachel Quest, and I am a current student at Northwest Florida, enrolled in their bachelor's program. As part of the curriculum, it was my objective to evaluate a PICO question. That brings me to this presentation: Individualized Diabetes Education. When managing diabetes, there are three types of management. Individualized management. This is when the patient and the healthcare professional work together to help the patient achieve diabetes management goals. Usually, this type of education focuses on the patient and any barriers they have with the management of their diabetes. With individualized education, the healthcare provider is able to work with the patient and their family to achieve desired goals. Any cultural concerns are also addressed. The patient will also become accountable for their progress, and the healthcare professional will hold them to it with follow-up appointments. The second type of diabetes management is through group education classes. These are less focused on the patient and more focused on the goals of the group. Each of the members work together to encourage each other to self-manage diabetes education. Education in these classes are broad and are focused on dietary and exercise. Lastly, there's the third type of management, which is not managing your diabetes at all, or through self-education using resources such as the internet and articles. The research into finding appropriate articles for my PICO question was attained through 4 different databases. With Gale, I used the keywords diabetes, education, and quantitative. Articles needed to be written within the last 5 years and needed to be full text. This populated 13 results. Next was Sinhal, Cumulative Index to Nursing and Allied Health Literature. Keywords for this database were diabetes and education. The articles were further narrowed down to being full text, peer-reviewed, and written within the last 5 years. This gave me 636 articles. The third database was ProQuest. Keywords were individualized, diabetes, and education. The articles needed to be full text, peer-reviewed, and within the dates of 2010 to 2019. This gave me a staggering 1,972 different articles. Lastly was Medline. Keywords were diabetes, education, and qualitative. The articles were only narrowed down by being full text, and it populated 668 results. That brings me to my PICO question. Do individualized education classes improve diabetes management by the patient better than patients with diabetes who are community educated? Broken down, the population was clients with diabetes. The variable of interest was individualized education classes. Comparison was community education classes, and the outcome improved diabetes management. Findings were narrowed down to 3 different articles that best fit the purpose of my PICO question. The first article was Diabetes Education Through Group Classes Leads to Better Care and Outcomes Than Individual Counseling in Adults, a population-based cohort study. This article had great relevance with the different methods of diabetes education, which was directly related to my PICO question. The study was very large and collected through public databases. The study was blind and unbiased. The results of the study revealed that patients taking the group classes for diabetes management were less likely to have issues from mismanagement. The second article was Strategies for Improving Participation in Diabetes Education, a qualitative study. This article was focused on the initial management of diabetic patients. Participants in this small study had never attended any diabetes management classes. This study focused on analyzing the patient's attitudes to diabetes education. The studies found that non-participation attitudes were related to physicians' influence, state of health, condition, avoidance, and refusal of knowledge and activity. Limitations of these studies were related to the small size, only 14 participants. The final article was titled, "The Effectiveness of a Community Health Program in Improving Diabetes Knowledge in the Hispanic Population. Salud y Bienestar, Health and Wellness." This study was based off a quasi-experimental group. There were pre- and post-tests. The biggest contributing factor to diabetes management was related to inappropriate portion size and sedentary lifestyles. To use what I learned in the research of the study will be a simple step in the education of patients. I will be able to teach the importance of exercise and diet with correct portions. I will provide education based on the patient's educational level and cultural background. I will also encourage patients to be accountable for their progress. Thank you very much for your time, and I hope you have a wonderful day.